Welcome, welcome. So for those of you who are joining us here today, just a reminder that this session we'll be discussing the use case for biometrics, including a verified service delivery, deduplication of records, and continuity of care. And throughout the session, we're going to see an integration, showcasing enrollment, identification, and verification functionality. So I'm really excited to welcome Simprints, the Chief Product Officer and co-founder, Alexandra Gregoire. Alexandra actually developed the first mobile, rugged, ergonomic fingerprint scanner designed specifically for frontline workers, as well as an end-to-end solution for NGOs and governments in sub-Saharan Africa and Southeast Asia and South Asia. Joining her is Dr. Wisdom Atiwoto, the Health Information Specialist from the Ghana Health Services. Dr. Atiwoto is an experienced physician with graduate training in health informatics. He leads the Ghana Health Services M&E effort and the expansion of their telehealth program, and for the last 15 years has been actively involved in the digital transformation of Ghana's health system through various digital health initiatives and that span areas such as patient care, health insurance, and M&E data and systems. Alexandra and Dr. Atiwoto, welcome, welcome, welcome. We are so excited to have you here today.
Thank you very much.
Thank you. Hello.
All right, so if throughout the session, feel free to put your comments and thoughts into the chat. You can also use the Q&A function. We'll have about 15 minutes at the end for questions and anything else anyone wants to ask. So with that, I'm going to hand it over to Alexandra to kick us off.
Great. Thank you so much, Nicola. And just a reminder for everyone, there is a poll as well that you can find next to the chat function. It asks you simply if you used biometrics before. So if you have 2 seconds, please feel free to click on it. Let me share my screen. All right, so hello everyone. I'm Alexandra, I'm the Chief Product Officer of Simprints. Today I'm going to talk about how to reach every patient through embedded biometric functionality within the DHIS2 eTracker app. So I will start with introducing the main motivations behind using biometrics, followed by a demo of our existing integration, and finally Dr. Atiwoto from the Ghana Health Services will speak about the potential advantages of biometrics within his context. So there are many incidences and reports of data that is coming from electronic medical record system not being fully accurate, and sometimes the duplication rates are pretty significant. A real-world example is from Brazil, where a study showed that from 140 million records, only 100 million unique patients were represented. So having multiple records for the same person can lead to a decrease in continuity of care, an increase in the possibility of wrong treatment administration, and ultimately hurting patients. Additionally, there are also large discrepancies between coverage data of certain interventions drawn from the electronic system versus what is reported through health surveys. So for example, in Chad, the difference in vaccine coverage between admin data and WHO surveys can be over 50%. This was actually taken from a report from 2009. And this unreliable data can lead to poor surveillance and monitoring, ineffective policy interventions, and also excessive resources potentially being spent on monitoring and evaluations. So how can biometrics help? According to the World Bank, biometric digital identity can be a game changer in global health and also beyond. Biometrics are technically a way of recognizing individuals based on physiological or behavioral characteristics, without requiring physical credentials that can be lost, damaged, or stolen. And there are, of course, many privacy implications in using biometrics, and I'm happy to cover any questions around these topics at the Q&A. We did focus this presentation specifically on showcasing the integration that we have with DHIS2 and also on the use case, particularly for the Ghana Healthcare Services. So I haven't covered the privacy aspects, which are, of course, incredibly important when using biometric data, and I'm happy to answer any questions. So concretely, biometrics can be used to verify an interaction or transaction between a healthcare professional and a patient, regardless of the nature. Could be a simple routine visit, administration of a treatment or a vaccine, a health surveys, anything really. By having a biometric footprint of every interaction between the two players, the data is therefore verified. And by adding timestamps and GPS locations, then we have the who, the when, and the where questions which can be answered without really requiring any additional information about the patient. So a couple of examples where this verification has had real impact are from Bangladesh, where a cohort of healthcare workers using biometrics had an 11% more PNC visits and 38% more visits due to increased accountability of the healthcare workers. Or in the case of aid distribution, a significant reduction in fraudulent claims was also seen. But to come back to the technology, which is a big focus of this conference, the technology itself consists of a companion app that is integrated within common data collection platforms and guides the user through the collection of biometrics. In our case, for Simprints, we use fingerprints and face images for now and exploring other biometrics modalities. The application runs a matching algorithms and issues a unique ID that is then linked to the medical records. So the biometrics themselves is not linked to the medical records directly, but a unique ID, random ID, is issued and links the medical record. And I will explain a bit more what happens in the background when I will show the demo in a bit. So if we go a bit more in depth when it comes to biometric processes, we have two main processes, which I'm going to also show in DHIS2, but first I wanted to give you an overview. The first one is during the client registrations. When you create the first record, you capture the basic biographic information, for example, in the DHIS2 eTracker app. And you can also capture the biometrics. And this will be on the Simprint side in our case, or in any other application. You have the capturing of biometrics, and the unique ID that I just mentioned is issued and linked to the biometrics. And also you can link it to a physical credential. This is optional in some programs. A physical credential like QR codes or the health passport is advisable. And I'm going to explain in a bit why. In some programs, having some physical credentials is just not feasible at all. In the second stage, during the service deliveries, there are two possibilities of using biometrics. One is identification. This is one-to-N matching, finding a person from a pool of patients. In this case, there might be a lack of other form of identification, like a physical credential or something like that, and that's the only reliable way, really, of finding the record that you're looking for, especially if the name might be spelled in a wrong way, if there might be multiple records that have the same name associated with them or the same phone number if that is used as an identifier. This biometric identification can be an alternative way of finding the right record. The other one is verification. This is a one-to-one match, and this typically requires a physical credential or an alternative form of identification in order to find the record, and then the biometrics is used just to verify that the person is the right person. So in both cases, biometrics is captured and matched with the database that is existing on the mobile phone. A unique ID is retrieved, which is connected to the medical record and then therefore displayed on the phone. It will make more sense when you'll see the demo in a second. All right, so now I'm going to run through a demo of the DHIS2 tracker and Simprints. During general registration, a person is first recorded and the biometrics is registered as another attribute to their records. So if you're familiar with DHIS2, you will be familiar with how attributes are set. I'm going to talk a little bit how to set everything up on the server side as well. So in this case, we're going to record Michelle Obama. And her biometrics will be recorded by pressing a button that you're going to see in a moment, Get Biometrics button. The user is now sent to the Simprints application, where there will be first a consent screen, and the logos and everything can be customized for the client. And you'll see we embedded the consent screen within the product. This is optional, by the way. Clients can decide to remove the consent screen if they already have it included in DHIS2, for example. But we do strongly recommend to partners to use a separate consent for biometrics and use this as their legal basis for capturing biometrics. Users also have an option for parental consent, and this can be, of course, translated in multiple languages. And we have a more detailed privacy notice as well, which can be, we usually translate in the language of the patients themselves, so it can be easily read by the users. Then we follow the next screen. I mean, our app is very simple. It has only two screens, really, is the consent screen and the capture screen. The first one, and I pause here for a second, is very quick in general and gives some rough indication and guidance to the user on how to collect a face image. This demo, by the way, is with facial recognition. We also have fingerprint recognition as another modality, which employs a separate hardware device. So the face recognition collection now, the whole process, by the way, I'm doing it very slowly, but it takes about 22 seconds. This is data that's come from a recent project in Mozambique. So you've seen the collection happened already, and you see here the flag of biometrics being completed for this particular record, and all the other attributes or information can be completed either before or after the registration. So after the capture, the user returns, as you've seen, to the tracker, and during the next visit, the user can then choose whether to verify or identify a patient. Sorry, I think So during the give me 1 second, I think I skipped, yes. So during the verification step, the records needs to really be found through a different method. You know, as I mentioned already, we recommend using some sort of physical credentials to retrieve the record. Once the record has been found, then the verification can happen. The same collection, the collection looks exactly the same for verification or identification, and it does for enrollment. It's relatively quick, and you will see in a second, I think I ran through an identification, and you see here the verify button at the case level. You can verify someone at the case level, or you can verify someone also at the form level. If you have multiple services, and once you click, if you want to set it up and make it mandatory, the first thing that pops up will be really the verification screen before you proceed with the delivery. So you see here we have a different photo of Michelle, and the verification is happening. One very good match, and we have a successful verification. Now, if Michelle didn't have any physical credentials, for example, we will need to run an identification. Sorry about this. For identification, we will need to run basically a search. And you'll see in a second that next to the magnifying glass here, we have an icon for biometrics. This icon can be customized to be a face image, a fingerprint, whatever you want, to run basically an alternative search using the biometrics. And now it's going to open, after clicking that, we're going to open the same application, the exact same workflow. We're going to use a different image this time around. We do recommend getting consent every single time because you don't know if the person has actually been enrolled or not. So during an identification, we found the right person is the first one here on the list. Then we click on the person, and here it is. We have the retrieved record. Now, if we're trying to identify someone that hasn't been enrolled in the system already with biometrics, like we're going to do in a second with Barack Obama, you have the option of still enrolling them without having to recapture the biometrics. So this feature is called Enroll Last. You see here, Enroll Last Biometrics. and you basically use the same enrollment data, the same data that you capture for identification to enroll a new person without having to recapture the biometric data. So now we're going to enroll Barack Obama as well with a new biometric. So these are just several features. We have additional features as well that we haven't showcased in here, but several features that the application and the integration has at the moment. So we're going to show in a bit also the Simprints dashboard that will have some basic stats around syncing records on the device. So if you open the Simprints app, there you see here syncing status, how many records have synced, how many haven't, from enrollment, identifications, and verifications. You can set it up for a different date. And you also have different features as well, like setting up the language. We have it so far translated in 15 different languages, as well as additional sync information. You know, how many records are to upload, how many records as well to delete. So I'm not going to have time to go in depth right now through records deletion. But obviously, when you have duplicates, for example, from multiple phones that get synchronized into a centralized database, we can run a deduplication, and then we can delete the duplicate records and propagate it through the phones. The deletion will have to be both on the Simprint side with the biometrics, as well as on the DHIS2 tracker side with the actual medical records that with all the biographic information or the records being merged and so on. We can group the data, the biometric data, in modules, and the modules can be mapped onto different geographical areas from the e-tracker. You see here we have a couple of different modules. We can select the modules. We can search through multiple modules that can be synced on the device. So if you're familiar with the e-tracker, and the syncing is very similar, we have different syncing and search functions. You can search on the device, you can search through the entire database, and also you can sync the entire database, or you can sync just the user records, or you can sync just the modules. So you can see here we have module sync activated, and you can select how many modules you want to sync on your device. And I think that's it in terms of like the demonstration. Obviously, I can show different parts during the Q&A, and if you have any questions, I'm happy to answer. And the last thing I'm going to cover is actually the changes that need to be made on the DHIS2 server side. There are very few changes at the moment. I would say that right now the solution is custom. We are working with the DHIS2 Oslo team to hopefully soon have integration with the main DHIS2 repository. Right now we have a fork where we've built the first integration. But the setup right now is quite easy. We have a config data in the data store. It configures the Simprints project ID, which icon to use, the confidence score to accept a verified match, and the amount of time a patient stays verified for. The tracked entity attribute is part of the patient metadata. So we can link the record to our Simprints record with the GUID, with this unique ID that we generate. This is searchable and unique to the patient. And the data element needs to be added if you want to have a verification in a program or in a form in particular. So everything right now is in a config file. Hopefully it will be more one click and a bit easier in the dashboard soon, but so far seems to be quite straightforward to set up. I'm going to stop here. So I'm going to pass it now to Dr. Ativoto to talk a little bit about how biometrics can support Ghana's health sector. Dr. Ativoto, over to you.
Thank you very much, Alexandra. I'm very excited to be part of this. Let me say that in Ghana now, there's what we call an explosion in digitization within the healthcare space. For instance, there's a large-scale deployment of electronic medical records across all government hospitals. There's also an upgrade of a telehealth program to increase coverage. DHIS2, based on the DHIS2 platform, is widely in use. And now we are deploying a lot more e-tracker for various programs and for various facilities as part of our mHealth deployment strategy within the Ghana Health Service. So next slide, please. So that is coupled with the fact that in Ghana now there's a law. There's been a law in existence for some time now, the data protection law, that is placing greater responsibility on the Ghana Health Service to keep the many patient data they gather safe and protected. I must say that this requirement to protect patient data have become very stringent because we want to prevent the issue of abuse. Again, we realize that COVID-19 and the many other interventions is driving a greater need for patients to be involved in their own care, and therefore providing a patient-facing IT-enabled services have become very critical, like the telehealth. There's also the need for us to track patient journeys within health facilities and between facilities, as we have in the case of referrals, and then also ensure that there's continuum of care for every Ghanaian everywhere. We realize that biometrics presents some opportunities for us to safeguard patient health data in the support of healthcare service delivery. But which areas can biometrics help? We have identified 4 broad areas. We're looking at biometrics helping us among health workers. We're looking at biometrics helping directly with patient care. We're looking at biometrics supporting the health system, and then also biometrics for the patient's own use. Next slide, please. So among health workers, one of the areas we are looking at is single sign-on to prevent what we call the password fatigue. For many health workers, password fatigue have become a huge problem. The stringent requirement for passwords to meet certain standards have become another problem. So we think biometric presents us a very good opportunity to jump over all these hurdles. Because of the single installation and the multiple electronic systems being deployed in the health system, it has also become necessary for patient data to be accessed securely, and then also to make it traceable for anybody who accesses patient data. We also realize that modernization of healthcare infrastructure is demanding that some aspects of hospital buildings are accessed using biometric technology. And then we also want to look at the issue of password sharing among health workers and the related issues that arise from that. And then now with disease outbreaks, we're also looking at safe use of biometrics in what we call the contactless biometrics technology. Next slide, please. So for patient care, we think that digital disease registries can benefit extensively from biometrics. And one other areas where we can, that's so helpful, is the issue of unique patient identifiers. This has remained a problem for even electronic medical record systems. But with biometrics, this can be easily eliminated. And we are very glad that the Simprints solution provides mechanisms for deduplication and others. We are also looking at care monitoring. Now that patients have to share monitoring devices during their care, we think that biometrics can help us so that we don't have the situation where we mix patient data with others. And then also, we think biometrics can reduce some of the hassles patients go through as they journey through the healthcare system. The requirement for doctors and nurses to always be typing password at various levels sometimes slows them down and it demotivates them in the use of digital health solutions. Next slide, please. Finally, among patients, we are looking at the issue of remote patient monitoring. Patients now want to be more involved in their care. There are mHealth solutions, mHealth systems, devices, wearables. There are also portable devices that is being used. Biometric can help us with that. And biometrics can also help us with sharing of clinical information on patients. And then it also help us with authorized access to patient records, as we have mentioned. So these are the three main areas biometrics can help us. Lastly, is the issue of the health system. Within the health systems, we think that the issue of deduplication or duplicate patient records will be done with once and for all with biometric systems. We also think that biometric systems can help us eliminate fraud in health service utilization among the National Health Insurance cardholders in Ghana. Indeed, in Ghana, the introduction of biometric member verification by the NHIA has significantly reduced fraud. So in summary, these are the 4 main areas where we think biometrics can be useful within our health system. In conclusion, what I would say is that the potential is enormous. We need further innovation to understand the full extent biometrics can be used within Ghana's healthcare. And starting with what we have started in Eastern region will give us a proof of the concept, and will also show us many other ways we can benefit from this biometric technology. Thank you very much.
Great. Well, thank you both, Alexandra and Dr. Atiwoto. We have a number of questions, but your last point, Dr. Atiwoto, I think is really kind of a sort of crucial starting point, I think, for this discussion, in that biometrics have been used for centuries, right? Either within the healthcare system, but what is really stopping, you think, broader adoption of biometrics more broadly? And in what cases does it make sense to use biometrics over sort of a more traditional, potentially paper-based identification process? And where do you see, and Alexandra, maybe this is for you, where do you see where are the barriers? What are the challenges to really helping to spread the adoption of a biometric system within the healthcare systems?
So let me start. Like every new technology that is introduced in the healthcare system, adoption goes to a certain life cycle on its own. The concept has to be proven. People will have to trust that those are better methods. And we think that it's because we have not tried, basically because we have not tried putting biometrics in healthcare. We must also understand that we are now going through a maturity process regarding the use of digital health in direct patient care, frontline patient care. The traditional thing has been for us to provide a service, and then we gather the data using the digital health systems. But now we are going direct. And once we have made a lot of progress in that area, we are beginning to bring in these additional technologies. And the driver for us will be a successful implementation with the pilot that we are doing in the Eastern region of Ghana. I think once people see the benefit, once we can show that, yes, it's useful, adoption can become very easy. The areas we can use, like I said, have to do with reducing the workload. No, password fatigue is critical. It's password issues are small in the gamut of things, but when deployed on the ground, realize it's a major demotivating factor for a lot of people. It's a stress point for a lot of health workers whose focus is to provide care and not to play with IT systems. So with biometrics, using facial recognition, using other biometrics methods, the requirement for them to input password is eliminated, and the flow, a patient flow becomes smooth, and then we can move on from there. Yeah.
One thing that you said, Dr. Atiwoto, was about sort of trust, right? And
yes.
whether or not patients, whether or not there is trust or even mistrust. And we know that in some cases in other countries, biometrics have actually been used for national surveillance programs in not good ways. Have you experienced any resistance among your beneficiary population in terms of not trusting this or potentially to be used against them in some way? Or have you seen rumors or misinformation that you had to sort of tackle and challenge throughout part of this rollout?
The good thing for us is that, first of all, we have not experienced or heard of any misinformation. The second thing is that there's ongoing national scale-up of biometric systems. In Ghana now, the national ID is a biometric-based system, and now there are a lot of requirements by government agencies or organizations for patrons to use biometric, the national ID, which is a biometric system. Now without that ID, you can't have a bank account. You can't even have a cell phone number. You can't have a tax identification number. So everybody is driving to get that national ID, which is a biometric base. So it becomes easy for us to piggyback on that and ride on that platform. There's a national awareness. The issue of abuse and mistrust have not come up. So we just enjoy the wave and then deploy this as we move on.
Good. So there are a lot of questions that have been coming in, and luckily Jonathan has been helping to answer them. But let's try and bring them to the discussion here. From Andrew Carlin, what is the average use time to collect and verify a biometric ID? And have you done any time motion studies on this?
That's a great question. So the average time depends on the modality. We actually done some studies with the data that we have recently, and in one particular program, the average time to collect fingerprint was around 60 seconds for multiple fingers. So it really depends on how many fingers you want to collect. I think if you collect only 2 fingers, it can drop down to about 30 seconds. The more fingers you collect, the more you go up to 50, 60 seconds. Depends as well on how comfortable the users are with using the technology. We've seen actually a decrease in the time that it takes in time. So the more comfortable the users become with the technology, the quicker they become in capturing the biometrics. And for face recognition, the average time was actually 22 seconds. So it's much quicker because, of course, you don't have a separate hardware device. But I would say overall, with the consent and everything, it would be under a minute. I'm not sure what you mean by time motion. We did see a decrease in time of the time that is used to collect the biometrics as the users get more comfortable. But I'm not sure if you can clarify maybe with a subsequent question. If I haven't answered, it would be fantastic.
So there's another question here that I actually want to add on a security part of this, because to your point, Alexandra, early on, you're saying the security around biometrics is an incredibly important part of this. So Amasfawa Tafera from Ethiopia asked, first of all, how are any biometric data stored? Where are they stored? How are they stored? And I think adding on to that, what are some of the security implications and considerations that need to be built into any type of this system?
Yeah, that's a fantastic question. So there are 2 major ways of storing biometric data. One is storing the raw biometric images, whether it's face recognition, fingerprint, palm, 4 fingers, whatever modalities you employ. You can store the raw biometric data, or you can only store an encrypted template. Template or embeddings, these are terms used for a string of numbers, basically, that have the unique points, either from a fingerprint or from a face. And sometimes these points are correlated to some physical characteristics, or if you use machine learning, they will not be correlated with any physical characteristics, is whatever the algorithm decides that the points unique of that person will be. Now, these templates can be encrypted and basically not able to be transformed back into the original image. So from a security perspective, holding only onto encrypted templates would be ideal, because even if there is a data breach, for example, with the templates, then there is nothing really that can be done with the data, especially if the data is kept separate from any other biographic data. And this is what we employ, and what we recommend is the siloing of biographic data and biometric data in 2 completely separate databases with different encryption keys and so on. However, the drawback, obviously, of using these encrypted templates is interoperability. So sometimes raw biometric images are stored to increase interoperability with other systems. But what we recommend is not to store any raw images on the mobile phone, on the devices themselves where the data is collected. So if interoperability is an important aspect, The data can be only uploaded to a centralized server, which can be cloud or a local database, again, kept separate from any other biometric data, and ideally with very, very strict access control. So most breaches will happen due to poor access control, not actually someone hacking into the system by brute force, but by finding the credentials somewhere. So very strict access control, and ideally never accessed unless there is like a change of vendor or there is a requirement of merging two systems or something like that. But day to day, we recommend using these encrypted templates that don't really have any value from a security perspective, and that can only be used by a certain algorithm to identify or verify a patient. But obviously, there are a lot of considerations when it comes to security. Encryption at multiple levels is incredibly important, and very strict access control and storage of the biometric data. At the moment, Simprints uses cloud with very, very high security for storing the data. But if there is a requirement for storing the data in the country, we can provide that if certain conditions when it comes to the security aspects are fulfilled.
So earlier there was a question about actually what type of biometrics was this? This is actually using facial recognition and also fingerprinting.
Exactly.
But there was a question about, are there other types of biometrics that you guys have been thinking about potentially incorporating into your device?
Yes, so we are thinking about palm or 4 fingers. I saw a question about palm vein. Palm vein, not at the moment, because they require separate hardware devices, which are pretty expensive. So it really depends of the application. If there is, a high security application that, is not fast of paying, quite a significant sum on separate hardware devices, we're trying to focus now on lower cost solutions that can be done with a mobile phone camera simply. So this is capturing a photo of your palm or capturing a photo of 4 fingers with the phone camera. So these are areas that we're exploring at the moment as alternative biometric modalities.
Dr. Atiwadu, I wanted to ask you, there was a question about sort of the usage of this device sort of offline, online, does it have to be online all the time? The answer is no. I assume because the data is captured on the Android device itself until it sort of reconnects with the data network and then is able to synchronize. Is that correct?
Yes, that's correct.
What have been some of the challenges that you've seen on the ground around kind of how the actual health workers or community health workers who are using this device have been able to sort of establish their routine to find that connection point?
It depends on the specific areas you are looking at, because though we have very high internet penetration in Ghana, we realize that the penetration is not uniform across board. So in areas where there's challenge with the internet availability, the bandwidth, we have situations where sometimes synchronization gets truncated midway. But what we have realized is that eventually when there's good connectivity, it gets done. But this adds some amount of frustration to the health worker, because sometimes they are not sure. But we also realize that in adopting this technology, there's some amount of learning curve and adaptation that the community of workers go through. Increasingly, what we're realizing is that for most of them, after some period of usage, they get used to it, becomes routine. Don't forget, they were already using e-tracker to do data collection. So the learning curve is not so much. But nonetheless, they will still have some curve to overcome and master. That period is not too long, but it also varies, depends on the confidence of the user. But overall, they're able to do that in a relatively short time. Yeah.
Okay, and Jawathri actually asked a question I had. Can you actually talk a little bit about the integration of the Simprint and DHIS2 synchronization? What information is actually passing over to DHIS2, and what information potentially goes back to the Simprint device?
Yeah, I can talk about that. So the information that we're passing is this unique ID that I was mentioning. So we capture the biometrics, we get a template, we delete the raw data from the device itself. It's actually optional to delete it completely, depending on the partner's requirements, if they want to store the biometric data or if they want us to store the raw biometric data. And we issue this unique ID, is a string of numbers, random numbers, global unique ID that is then passed back to the DHIS2 eTracker app. So this is really the only data that is being passed on during an enrollment. During an identification or a verification, we also pass the confidence scores. So biometrics, like any other biometric matching, like any other type of matching, whether it's fuzzy matching and so on, has a percentage in accuracy, right? It's not 100% accurate. It can be 99.999 accurate, can be 90% accurate. It really depends on a lot of factors. That's maybe a topic for another conversation. But the confidence score is really what determines whether there is a good match or maybe like a so-and-so match. So we pass on the confidence score to the eTracker, and then on the eTracker, you can have some logic on what to display to the user if a match is a high confidence score or a low confidence score, and so on. So these are the types of data that we pass to eTracker. In terms of what eTracker passes back to Simprints, it's once you call out to Simprints the first time, you need to pass on the project ID. So this is done for security purposes. The project ID, the module ID, and the user ID. These are information that are passed on to Simprints for every call out. And then once the user, let's say, clicks on a name, like Michelle Obama is the Michelle Obama, then we have that confirmation of a good ID or a good verification sent back to Simprints. So we can have stats on the accuracy, and we can calculate automatically the accuracy metrics for a specific project. So that's it. There is no other biographic data, nothing else really that's passed between the two apps. Most of it is event data that's being passed.
Okay, and so this actually keys up nicely with another question that came up was, do you actually have to identify or have a list of everyone within the catchment area where you're using it in order for this to work?
So if you are trying, it depends. So if you're using verification, let's say, like Nicola came to the clinic and Nicola has been registered by another healthcare worker in another catchment area. So Nicola's record is not, like biometric record is not on the device of my device. If you try to verify Nicola and you're offline, you're not going to be able to. However, if you're online and both DHIS2 and Simprints have the global search functionality on, then you will be able to find Nicola online in the global pool and then pull up her record. So it's obviously, if you're offline and the record is not on the device, both on the eTracker and on Simprints, you won't be able to retrieve it. If you're online, then you will be able to retrieve it. For an identification, because it's a search, it at the moment works only on the device. So if you're trying to search for Nicola via biometrics, if Nicola is not on the device or the catchment area, which is synced to the device, then you're not going to be able to find Nicola.
Okay, well, with that, I really want to thank Alexandra from Simprints and Dr. Atiwoto from the Ghana Health Services. Thank you so much for joining us here today.